I had been suffering with some pain in my side and reluctantly went to the doctor. When I showed him what my concern was, I could tell from the look on his face that this wasn't something small or minor. He ordered a CAT scan for me, and 2 days later a biopsy, which confirmed that I had lymphoma.
My sister and I went up, and on a Thursday, I believe, he told me that I had cancer.
I was not supposed to have cancer. It's not in my family. I was relatively young when I had it.
When a person is first diagnosed with cancer, there's initially an emotional impact that they go through. You know, nobody expects to get cancer.
The tumor board is a time where we sit down with all of the specialists. The primary care physician is invited to describe how the patient first presented with the problem. And then the treatment options are discussed.
A short time later, I began chemotherapy. I had 6 chemotherapy treatments here at the Cancer Center.
Well, frequently chemotherapy will be used to sensitize radiation, that is, make radiation work more effectively. Frequently we'll use combination chemo and radiation to treat patients before surgery, or we'll use it more definitively to treat in a curative fashion.
I had radiation, I think it was like 32 or 36 days.
Radiation is primarily used to treat cancer cells while sparing the normal tissue surrounding the cancer cells. The cancer needs to be eliminated by the radiation locally, and that's what radiation does.
Actually, I was very impressed with many of the procedures, the CAT scans, the MRIs, the PET scans. You know, this wasn't a case where I had to travel 20 miles for this test or 40 for that.
We have a unique ability to have a combination of the most up-to-date equipment and technology available to us, but we also have this warm, caring staff that really look after the patient's needs.
The staff was excellent. At the cancer clinic, they are amazing. I could not do their job. I commend them. I mean, they were there for you.
The staff here is just a wonderful staff. Very friendly, very caring. We got to be old friends by 7 weeks every day.
Our patients are ordinary people who are facing a health crisis, and they pull upon an inner strength and courage that is truly inspiring.
The patient navigator I call the miracle worker, because she is able to bring together all those loose ends which could fragment the patient's care and recovery.
It is almost as if everyone here has personally experienced it. Not just a family member, I'm talking personally. And they address your concerns, and they treat you from that firsthand knowledge.
I feel excellent, wonderful. Actually better than before I found out I had cancer.
I'm cured of cancer. I don't have cancer anymore. I have a real feeling of gratefulness.
For me, the choice was simple.
For me, the choice was simple.
For me, the choice was simple. Claxton-Hepburn for cancer care.
I wouldn't want to practice anywhere else.